Okay, today I'm going to be inserting a urinary catheter on my patient. The first thing I want to do is perform hand hygiene. Okay, and I want to check my doctor's orders to see that it is correct, and I am definitely going to insert a catheter to my patient. I want to check what the doctor's orders are. So I want to see what type of catheter I'm going to be using, and also what size and stuff like that. And then I want to check once I already verify the doctor's orders and everything's correct, and I know what my patient's allergies are, the patient's name, date of birth. So that's what I'm looking for in my doctor's orders. So I checked her allergies as well. And then I'm gonna look into getting my equipment ready. So I know I'm gonna be inserting a Foley, and so I have it right here on hand, and I have to check that it's the correct size and the correct stuff that I need. And I also want to check that it's not expired, so it has not expired. And then also, so grab everything that I need prior to going into my patient's room. And then I'm also gonna get a privacy blanket because my patient needs to maintain privacy, so she can feel more comfortable. Okay. So now that I have everything ready, I'm gonna wash my hands, perform hand hygiene. Hello, my name is Carla. I am student nurse. I'm going to be inserting a urinary catheter on you today. Is that okay? Okay, my patient says yes. And could you please tell me any allergies that you have? Okay, she says there's none. She doesn't have any allergies. So what I want to do is I want to verify my patient with her identification bracelet. I want to see that it's the correct name, date of birth, and I also want to see if she does have an allergy band. But she said she didn't have an allergy, so she doesn't have allergy band. So no allergies. Okay, so what I would do now is position my patient into a dorsal recumbent position. I would probably lift the bed up a little bit. I would check that the bed is locked so my patient doesn't fall. I want to grab my privacy blanket. So she's already in the position that I want her to be. And I'm gonna grab some gloves, and then I would check if she needed any sort of peri-care. So I already educated the patient what I'm gonna be doing with the patient so she's comfortable. And I already checked that she doesn't need any peri-care at the moment, so I would proceed. Okay. And I would position my trash accordingly so I have something to dispose of my materials. So now I have the Foley, and what I want to do is sanitize my hand one more time. So I have the Foley in hand. I open it. I already checked everything's good. I already checked that it's the proper one and it has not expired, so I can throw this away. Okay, so I'm going to be taking this out carefully as to not break it. And now what I want to do is open it up, making sure that I don't break sterile technique or that I'm not reaching over it. Okay. And I want to keep in mind that everything in here is sterile. So everything's sterile inside. And then I'm going to grab this, and this will help put it. I want to keep in mind that the 1 inch around it is contaminated already, and also with the one that's set down on the bed. So I don't want to be touching the inside of it, but I can touch and move it accordingly with the sides of it, that 1 inch. I'm gonna fold this, and then I would make sure the patient's leg is in a dorsal recumbent position. So I would reach actually underneath the patient's leg to position this inside. I don't want to reach I would tell my patient to move up a little bit, and then I would put this like that. But like I said, I wouldn't want to be reaching all over inside, but since I can't put the patient, so yeah. So yeah, now I want to grab my gloves. So I have my gloves, and I'm looking at my sterile field. So I'm gonna clean my hands one more time before putting on the gloves. Open my gloves up. And just let it go. I can grab this one and just let it go. Don't be touching it. And then I can just fix anything that needed to be fixed in the gloves if I needed to. Okay. I can use that as a trash, but since I have my trash here, I'm not going to be using that. So I would just discard that inside the trash. So I have this, and this is just to cover my patient's private area. I feel like this would get in the way, so I'm not going to use it. So I would just throw it away. And if it fell, I would just pick it up at the end. So now I am sterile. I can position this as I want it to be. Just keep in mind that, like I said, that 1 inch is still dirty and contaminated. So here it is. I'm just going to be positioning this. Okay, so I have my things here. I have the lubricant that I need. Okay. The first thing I want to do is make sure that everything is working properly. So I want to inflate my balloon just to make sure that, like I said, there's not any leakage, or that, I'll just throw this away, that there's no leakage or any rips in the Foley. So I want to wrap this around my fingers so it doesn't swing everywhere. So I have it on hand. And I'm just going to throw away this. Okay. And the way that you inflate the balloon is going to be according to the manufacturer. So how much you insert on here is going to be according to the manufacturer. So I'm just going to do 30. Oh. Okay, I see that it's working properly. There's no leakage or no water coming out. So I'm gonna just take this and de-inflate it. Okay, so I'm gonna leave it with the syringe already in there. And now I'm going to grab my lubrication and open it up, pour some on my tray, and discard this. And then I'm gonna lubricate the tip to 1/2 to 1 inch of the urinary tip, catheter tip. And then I'm gonna actually leave it here because I don't need it moved because it's already lubricated. And now what I wanna do is grab my sticks that have the benzo, and it's gonna clean my patient, okay? So I'm gonna clean my patient. I'm gonna take these out, put them right here on the side, throw this away. And now with my non-dominant hand, I would spread the labia, but since I'm in a different position, I'm still gonna be using my right hand. So this is gonna be the contaminated hand. So I'm gonna spread the labia. I'm gonna visualize the meatus, where I'm going to be inserting the urinary catheter, so because many women have it differently. And then so I'm spreading it, and then the first thing I'm going to do is grab one of the sticks and clean from front to back on the sides first, and then down the middle. So I'm going to come here, do front to back, come all the way around, throw that away, grab another stick on on the other side, spreading the labia, front to back, all the way down, making sure I get every single part, throw that away, and then grab the last stick and do front to back as well, down the middle, spreading the labia, making sure I get every single part, and then now she's clean. I'm not moving my hand anywhere else for this hand. So now I'm gonna grab my Foley, making sure it doesn't hit anything else. Okay, so I have my Foley. Like I said, this part is still clean, so I can position my Foley here. The first thing I want to tell the patient that to take a deep breath before I insert the Foley. So please take a deep breath for me, and then I'm gonna insert the Foley into the urinary meatus, and until I get a urine return. Once I get a urine return, I'm gonna still insert a little bit further in half an inch to an inch further, just to make sure that once I do inflate the balloon, it's not going to be within the, it is going to be in the bladder and not going to be hurting the patient. So take a deep breath. Okay, already got a urine return. Gonna insert it half to an inch further, and then I'm gonna grab it with my dirty hand so it doesn't move. Now I'm going to inflate the balloon according to policy, the manufacturer policy. And once it's inflated, I'm going to take the syringe off without it spreading everywhere. And then I'm gonna tug at the catheter just to make sure that it is in place and it's not gonna be coming out. So once it's in there, and my patient says she doesn't have any pain, I'm going to grab this, and then I can tie this on my patient's thigh. And since it's already in there, I'm no longer sterile. So this is where I would tie the catheter in my patient's thigh, and then grab the urinary bag down and make sure there's no coils or anything, because otherwise my patient's more prone to an infection. So I would do that. I would put it below her level so that she doesn't get an infection. So then I'm no longer sterile, like I said, so I would clean my patient, any residual that she has, make my patient comfortable. I discarded all the material that I no longer need, and then I would ask the patient if she's doing okay. I would take this off, and just throw it away. Perform hand hygiene, make sure she's comfortable. Like I said, I would discard my materials, take my privacy blanket off of her. I would give my patient the call light, and then I would make sure the rails are up for my patient not to fall. I would also make sure the bed is locked and it's all the way down so she doesn't fall, like I said. So she's comfortable, she said she's doing good. Okay, I'm gonna give her the call light, and like I said, I would leave. So once I'm out, everything's clean in my patient's room, she's comfortable, I'm gonna wash my hands, preferably with soap and water, not with sanitizer. So wash my hands, and then I would document what I did with the patient, which was a catheter insertion. I would also document how my patient took the procedure. I would also document what type of urinary catheter I used, the size, and also how much urine return I got, and also document how much I inflated the balloon with. So once I've documented everything and my patient's comfortable, like I said, I should be good.